thankfully we don't have a lecture exam to coincide this week. So what we're going to do today is finish up chapter 18 with the heart, and then 19 we'll start on Thursday. 19 we're going to start off with blood vessel anatomy, and you notice we haven't talked a whole lot about blood pressure regulation. That actually comes in chapter 19, because of course we can use the blood vessels to help regulate heart activity. So that's where we're going to get that come Thursday and next Tuesday. And if we stay on track, we're looking at having our exam next Thursday. Okay? So we're looking at chapters 18 and 19 next Thursday. One of those essay questions is going to be to trace a drop of blood through the heart. And basically I'm going to just give you a thing from that Scantron to write it down. All you need to do is list those structures starting with the right atrium, take me through both the pulmonary circuit and then of course the systemic circuit, and then end me back with the right atrium. If you want to use that list that's in your course pack and just jot down structure by structure that we pass through, that works just fine. And there's nice pictures out there on the internet like this one. This at least helps you out with blood flow through the heart and back and forth through pulmonary circulation. This one doesn't take you all the way through systemic flow, but it takes you up to that point of seeing where it leads through the aorta here with number 14. And then of course all you're missing is arteries, arterioles, capillaries, venules, veins, and then of course we're back with numbers 1 and 2. The only other thing missing from a picture like this would be the coronary sinus. Tracy.
So if we know that this.
Yeah, you're good. Yeah, you don't have to write deoxygenated versus oxygenated. Just list where those items, like tracing a drop of blood, where it goes. Yeah. All right. So any questions from last Thursday's material? Sure. Okay, question was to go through the EKG again. So let me just briefly run you through what we had last class period. What this EKG traces is the electrical activity of the heart. You might recall that we talked about two nodes of built-in nervous tissue. One is called the sinoatrial node, or SA node for short, and the other portion is called the atrioventricular, or AV node for short. What you're seeing here is the P wave first, and that occurs in response to the firing of which node? SA node fires. When the SA node fires, we talked about those muscle cells in the heart depolarizing. What happens during depolarization? Sodium enters, good. If we reach threshold, then of course an action potential is generated and we can promote a muscle contraction. So what you're seeing here is SA node fires as a response. The P wave is atrial depolarization. That means the atria are getting ready to contract. They're not quite doing it during the P wave, but they're setting up for that contraction. At some point beyond this P wave, we're going to have the AV node fire. What does the AV node promote? Good. It's going to promote a ventricular contraction. And of course, before we get those ventricles to contract, we have this QRS spike. They call it complex. And during that QRS wave, what is happening to those ventricles?
Depolarization.
Depolarization, meaning they're getting ready to contract. So they're responding to that nerve stimulus, the sodium is rushing into that cell, and we're depolarizing, setting up for an action potential. Now, you'll notice the QRS wave is a rather big one. Why is it bigger than the P wave?
Because the ventricle circle, more pressure.
More muscle, yeah, and more of a depolarization event. So you'll notice the QRS complex is actually bigger. Notice the spike here is larger, and that comes from the more muscle that's in those ventricles. Now, hidden behind the QRS wave is where you're going to have the atria contract. So you can't actually see a wave dedicated to the atrial contraction, but they say it's hidden back here behind the QRS wave.
Isn't that ventricle contract?
What's that?
The ventricles don't contract after the QRS?
They do. They do. But we're talking atrial contraction is actually hidden because it is occurring during the QRS wave, but you just can't see a wave for it. Okay, and so yeah, after QRS wave, your ventricles contract, and then T wave follows up. What happens during T wave?
Repolarization.
Repolarization. So we're resetting those ventricles so they can fire again. You might recall from Bio 210, we talked about the refractory period that these muscle cells must undergo, because that's that resetting period before you can have another depolarization event and another firing or another contraction. So ventricles contract after QRS before the T wave. T wave indicates that the ventricles are repolarizing. This whole picture up here is what we call a cardiac cycle. This cardiac cycle is approximately 0.8 seconds, and that works out to be about 75 beats per minute. Okay? Did y'all have questions on any parts of that EKG or what's happening when? We got into a topic on Thursday of last week, but I didn't quite get finished. We ran out of time, so I want to take you back to that topic on Thursday. And that topic was dealing with diastole or diastole, systole or systole, and regulating the heart valve, opening and closing, which of course is the pressure issue within the heart. So let me take you back to page 43. Okay, and they start talking about this information in your textbook around page 601. Probably more detail than you could ever imagine on 602, 603. We're going to start with mid to late diastole. This is the period when the atria are filling with blood. Blood drains back into the right atrium from 3 locations. What are they? Good. SVC, IVC, and coronary sinus on the back side, all bringing deoxygenated blood back into the right atrium of the heart. Into the left atrium of the heart, blood is coming back from where? Good. Lungs, pulmonary veins dump that oxygenated blood back into the left atrium. So we have blood filling both atria. It will drain down into the 2 ventricles, and at some point that SA node fires, causing what? Contraction. Good. So we're going to push the blood from the 2 atria down into these 2 ventricles. Let's keep track of the valves. As the atria contract, notice that these valves obviously are open as blood travels through. So AV valves are open. Semilunar valves, notice they are closed at this point. Okay? Now, getting a lot of blood coming down into those 2 ventricles. These are starting to fill with blood, and at this point the AV node is fired. Now what's going to happen next? Well, AV node fires. Ventricles contract. Okay. So this is something that we've got to kind of flesh out here. When that AV node fires and the ventricles contract, the first thing we've got to pay attention to is the amount of pressure down here. We've got a lot of blood in each ventricle at the end of diastole. Each ventricle holds approximately how many milliliters of blood? 120. So we're looking at 120 milliliters of blood in each ventricle at this point. And that, of course, is going to start to build the pressure for us. The other issue we have to look at is the regulation of that blood flow using these heart valves. So what we're going to notice here is when the ventricles contract, these AV valves are pulled shut. The pull on those capillary muscles down there in each ventricle pulls on a heartstring, those chordae tendineae, and by pulling on a heartstring, you're going to slam those valves shut. And that, in fact, is the first heart sound. When you think lub-dub of a heartbeat, that's the first sound that you hear is those AV valves slamming shut. For a very brief second, we're going to have all 4 valves shut, and you might recall that was a term on the bottom of page 43 called the isovolumetric contraction phase. Okay? Where is the majority of your blood sitting right at this moment?